Hey everybody, come on with me. I'm here today at Zubair Gynecology and Med Spa. I'm here to get my pap smear today. I know many of you are thinking, a pap smear, why do I have to get that done? Well, today, Dr. Michelle Zubair is going to tell you all about that, and you're going to get to watch me do the whole process. So come on. First things first, though, we have to check in at the front desk. Let's fill out some of this paperwork. Man, have you ever seen a gynecology office this beautiful? This paperwork that she has for me has a few questions, simple things, past medical history, if I've ever had an abnormal pap smear, when the last time I had a pap smear, pregnancy, and anything else abnormal that I might want to tell her about, or anything that I'm concerned about, such as vaginal discharge, vaginal odor, or anything of the like. So let me get to work and start filling some of this out, and hopefully she'll call me back soon.
Hi, how's it
Hi,
going?
good.
So we're here for our annual exam?
Yes,
Okay. Any concerns about anything today?
not today.
Okay. And when was your last pap smear?
My last pap smear was right before my daughter was born in October of 22.
Okay. So we are up to date on our pap smear, which is awesome. When was your last annual exam?
Same time.
Okay. So we're a little behind on our annual exam. So I always say annual exams should be every year, meaning clinical breast exam, pelvic exam, even if we're not collecting the pap smear, should be done every single year. The actual collection of the pap smear, that can be spaced out to 3 years if it's just the pap, or 5 years if you're doing pap and HPV. But every year you should still be seeing your gynecologist for a clinical exam.
Okay.
Okay.
So when I come for an annual exam without a pap smear, what does that include?
So that includes everything that we cover during your pap smear exam that you have. So clinical breast exam, going over your medical history, going over surgical history, pregnancy history, how your periods are doing, and then including a speculum exam or an examination of the vaginal area to make sure uterus is not enlarged, that the ovaries are normal, that the vagina looks normal, that we're not seeing any masses on the cervix. The point of an annual is a preventative visit. So we want to identify anything outside of the realm of normal, even though we're not collecting the pap smear.
So what is a pap smear exactly? I know it's something to do with cervical cancer, but what does that mean?
So a pap smear is a screening test that we use to screen for any precancer changes, HPV-related changes, essentially precursors to cervical cancer, as well as screening for cervical cancer. So essentially, you'll get an exam just like at your annual or any vaginal exam that's done. Visualize the cervix, and we'll take a small sample of cells from the cervix with a small little brush, send that off to pathology, and we'll see what the results show.
Wow. Are there any things that put me at risk for developing cervical cancer?
So HPV is the most common cause of cervical cancer. So I always encourage, if you've not been vaccinated for HPV with the Gardasil vaccine, I strongly, strongly encourage everybody to get vaccinated, as well as partners to be vaccinated. A few years ago, the guidelines changed. Initially, the vaccination was recommended up to age 27. Now we're recommending that vaccination up to age 45. Strongly encouraged because 8 out of 10 people will get exposed to HPV at some point in their lifetime. And there's no test for men. So we are the lucky ones that get to go and get our cancer screening done to make sure that, is there HPV or not? Because it's something that's silent. You're typically not going to have symptoms with any precursors. Typically, if there's advanced cancer, you might have symptoms of bleeding and things like that. But the goal of the pap smear is preventative. We want to catch things early.
Okay. If I were to potentially have cervical cancer, what kind of things should I be looking out for?
So one of the common symptoms is bleeding after intercourse. So if you're noticing any abnormal bleeding, that's an indication that, hey, you need an examination to see what that cause could be.
If I was on my menstrual cycle, could I still get my pap smear?
It's not recommended because the blood from your period can obscure the cells, and so we might not get an adequate sample.
Okay.
The other thing is I typically don't recommend intercourse like the night before.
Okay.
because again, that can obscure the sample that we're getting.
Okay, what about douching?
I don't recommend douching for anybody.
Okay.
That is actually going to worsen your pelvic health and the normal microbiome of the vagina. So we should not be douching.
Okay.
I typically just recommend cleaning the outside with gentle, soap and water. You do not need to be cleaning the inside of the vagina.
Okay.
I always say the exam can be very anxiety provoking. I will talk you through everything that we're doing, so nothing is a surprise to you. So anytime you'll feel me touch, anytime I'm opening the speculum, I walk you through every single step of the process.
Okay. What's next?
The exam.
Okay. Dr. Zubair, do you have any recommendations for me, like for my pelvic muscles as you do my pap smear?
So let me do an exam. Typically what we'll do is I'll first insert the speculum, I'll take a look at the cervix, collect the pap smear, then I'll do an internal exam to feel the uterus and ovaries, as well as to feel the pelvic floor muscles to see is there laxity, hypertonic pelvic floor. And typically those are things that can lead to other issues like constipation, bladder function, things like that. And most women don't know, but pelvic floor physical therapy is a thing and it can do wonders for the pelvic floor muscles, which especially after childbirth, but really after any point in your life, if you're a woman with a vagina, there's things that we do every single day that are not great for her.
Okay.
Even just sitting on the toilet for long periods of time, wearing high heels, wearing pants that are too tight, sucking our stomachs in constantly, all of those things we're kind of conditioned to do, but they're not good for the pelvic floor.
Okay.
Okay. You're going to feel me touch here, okay? And you're going to feel a little bit of pressure. And you're going to hear a couple clicks. And I'm just going to clean off your cervix here. And I feel a little bit of cramping. And one more quick swab here. The speculum's going to go ahead and come out.
Wow, that was really good. I didn't feel any pain.
Awesome. So a speculum exam should not be super painful. A lot of patients are scared to come in because of the pain and discomfort. I always say nobody's ever excited to see me in the office, but it shouldn't. If you're having a lot of pain, discomfort with the exam, that tells us that there might be something else going on with pelvic floor dysfunction. Okay. All right, I'm going to do a quick internal exam here to feel the uterus, ovaries, and your pelvic floor muscles, okay? Lots of pressure here. So uterus feels normal, and that ovary feels normal, that side feels normal. We are all done with the exam. You can push back and sit up for me.
Thank you.